While the most common burn injuries in the workplace are thermal or heat-related, others are sometimes caused by unsafe exposure to electricity or chemicals. And depending on the cause and the type of burn, they can range from minor to potentially life-threatening. Any treatment you administer should always fit the burn type and severity. Thermal burns respond well to localized cooling, which involves running cool water over the injury for 15 minutes or more, and then soaking a cloth or clean piece of material in cool water and applying it to the affected area. This helps cool the tissue until the pain subsides. However, you should only use localized cooling on a conscious person, as they need to be able to express the amount of pain they're in. Localized cooling shouldn't be administered for more than 2 hours, and you should only use cool water, never use ice. This method should also never be used to the point where the coldness causes additional pain. In the case of electrical burns, you should ensure it's safe to approach before doing anything else. If it's safe, check the injured person for breathing and a heartbeat. Then treat the person for shock by laying them down on their back, unless that's where the burn is. Treating an electrical burn is similar to treating a thermal burn. Loosely cover the burnt area with a clean, sterile cloth. Burns to the eye are particularly serious. An injured person with such a burn should receive medical attention as soon as possible. When treating a heat burn to the eye, cover the injured eye with a sterile pad or clean cloth pad. If you can, moisten the pad with water before placing it on the eye. Chemical burns need to be handled very carefully, because some chemicals give off toxic fumes that can be hazardous to both you and the injured person. If you haven't been trained to help someone who has been exposed to chemicals or has a chemical burn, you should wait for EMS to arrive. But let's say you've been trained on treating chemical burns. If the injured person has sustained a chemical burn to the eye, you should flush the eye with cool water for at least 15 minutes. Flush from the bridge of the nose outward to the opposite corner of the eye. Ensure the water is from a clean source and adjust the water temperature as needed to avoid causing further damage. If a chemical burn extends beyond the eye, you should remove all of the injured person's clothing to prevent any of the chemicals from being absorbed into the skin. You should then wash the injured person thoroughly for several minutes. Make sure to wear proper PPE to protect yourself from chemical exposure. Once the injured person has been thoroughly washed, cover the burn area with a sterile or clean cloth to avoid infection. You should also keep the person warm by covering them with a blanket or a piece of uncontaminated material to prevent them from going into shock. Once you've determined which first aid techniques to administer when stabilizing a burn victim, you can ensure they receive the necessary professional medical care. Now let's pause here so you can try some practice questions.